There's a lot in the philosophy of osteopathy. I think the greatest benefit is that there are four main principles that are applied to the body when we're looking for that root cause.
Okay.
You know, and you could say that any discipline that's a healing art that wants to help the patient is looking for the source,
Sure.
right, in order to give them benefit. But I think it's the application of those four principles that really makes the difference.
Okay. And I think that might be a defining point, too, in general for holistic medicine, is that looking for the source of the problem instead of just kind of finding a surface, a Band-Aid solution, trying to get to the root of the problem.
You know, and that might be best shown through an example. So
Okay,
I'll just come over to the skeleton.
Great.
You know, one of the more common things that a patient would walk into my office with is maybe lower back pain, right? So we'll look at the lower three lumbar vertebrae, L3, L4, L5. An osteopath is going to assess those things for structural integrity. So one of the main principles is that structure governs function. In other words, the structural integrity of the unit is dependent on how it's going to function. If you think of a garden hose in your backyard, right? If it's working fine and then all of a sudden the tubing is blocked or kinked or perforated, the function of the whole thing is compromised.
Right. Great
So we're going to
example.
look at the structure, you know, and to do that, to assess that, we're looking at position, mobility, and vitality. Is the position of the vertebrae in the right place? Is the angle of the vertebral plateau angled correctly for that part of the spine? Does it have mobility? Can it do flexion, extension, side bending, rotation, right?
Okay.
Is it vital? Is there a life force of vitality in that area? So if all of that's working fine and the patient still came in with back pain, I believe them, they're in pain, but there's no problem there, right? Then osteopathically we're thinking further afoot, thinking again, the second principle of the philosophy being that the body's a functional unit. So as a functional unit, I'm going to think that those lumbar segments are attached to the iliac crest. So then we have a literal attachment to the pelvis, and I have to look, how is that pelvis functioning in relation to the lumbar, and is it the cause of the problem for the patient's back pain?
Okay, so maybe if it's not that particular lumbar area, it's something that's connected there, that's contributing to it. Okay.
Sure. Yeah. Is there an anterior scar from an appendectomy or a C-section scar pulling forward on those vertebrae? Right. I'm going to be thinking digestive orders because, you know, ulcerative colitis, celiac disease, irritable bowel, anything that inflames that part of the lower sigmoid that's wrapped with a fascial sling onto the disc between L4 and L5. If it's pulling forward and rotating, that could be a source of a pinched nerve or something in the low back.
Okay, sure.
You know, but again, I mean, that's kind of global in the pelvis. You would expect us to look in that area.
Right.
Osteopathically, again, though, if that's functioning, we're going to go further afoot. I'm going to be thinking cranially as the C1, L5 vertebrae kind of balance two ends of the teeter-totter. I'm going to think muscle attachments to the lumbar. The latissimus dorsi attaches by a fascial girdle onto the lumbars, comes up onto the anterior part of the humerus and the shoulder. So someone's shoulder surgery 10 years ago, or a shoulder injury, something going on in their neck, could be pulling that muscle too tight on one side, and again changing the triangle of the mechanics onto that part of the spine.
Right.
I'm going to be thinking 26 bones of the foot, lower leg mechanics, how the person's hip, is in the socket, how the force of gait and gravity comes up through that mechanism onto the lumbar spine.